Part 2 for our key associations of disease or findings and the most common cause or important association. Temporal arteritis associated with risk of ipsilateral blindness due to occlusion of ophthalmic artery or polymyalgia rheumatica. Recurrent inflammation or thrombosis of small or medium vessels in extremities is commonly associated with Buerger's disease, strongly associated with tobacco. Cardiac primary tumor for kids, commonly associated with rhabdomyoma, often seen in tuberous sclerosis. Cardiac tumor in adults associated with metastasis or myxoma, 90% in left atrium, that is the ball valve. Congenital adrenal hyperplasia, hypotension, is commonly associated with 21-hydroxylase deficiency. For the Cushing's syndrome, it is most commonly associated with iatrogenic from corticosteroid therapy, adrenocortical adenoma for secrete excess cortisol, ACTH secreting pituitary adenoma for Cushing's disease, and paraneoplastic due to ACTH secretion by tumor. For primary hyperaldosteronism, commonly associated with adrenal hyperplasia or adenoma. For tumor of the adrenal medulla for kids, commonly associated with neuroblastoma, malignant form. That is malignant neuroblastoma. For adults, tumor of the adrenal medulla is commonly caused or associated with pheochromocytoma, usually benign. Cretinism, a common cause is iodine deficit or congenital hypothyroidism. Thyroid cancer, common is papillary carcinoma for childhood irradiation. Hypoparathyroidism, commonly caused by accidental excision during thyroidectomy. Primary hyperparathyroidism, commonly caused by adenomas, hyperplasia, carcinoma. Secondary hyperparathyroidism, commonly caused by hypocalcemia of chronic kidney disease. Hypopituitarism is commonly caused by pituitary adenoma, usually benign tumor. For refractory peptic ulcers and high gastrin levels, commonly caused by Zollinger-Ellison syndrome, that is gastrinoma of duodenum or pancreas, and is associated with MEN1. For esophageal cancer, commonly associated with squamous cell carcinoma, that is worldwide, and in the US, adenocarcinoma is also very common. Acute gastric ulcer associated with CNS injury caused by Cushing ulcer, that is increased intracranial pressure that will stimulate vagus and gastric hydrogen ion secretion. So that is Cushing ulcer. Increased intracranial pressure that will stimulate vagal gastric hydrogen ion secretion. Acute gastric ulcer associated with severe burns, commonly caused by curling ulcer. Curling ulcer is greatly reduced plasma volume results in sloughing of gastric mucosa. Curling ulcer. Bilateral ovarian metastasis from gastric carcinoma, associated commonly by Krokenberg tumor, that is mucin secreting signet ring cells. Bilateral ovarian metastasis from gastric carcinoma, Krokenberg tumor. Chronic atrophic gastritis, autoimmune, commonly caused by predisposition to gastric carcinoma, associated with predisposition to gastric carcinoma, can also cause pernicious anemia. Gastric cancer, adenocarcinoma is the most commonly associated disease. Alternating areas of transmural inflammation and normal colon, Kip lesion or Crohn's disease. Site of diverticula, most common in sigmoid colon. Diverticulum in pharynx, most common in Zinker diverticulum, diagnosed by barium swallow. Hepatocellular carcinoma is most commonly caused by can lead to cirrhotic liver. That is the most common associated findings associated with hepatitis B and C, alcoholism, and hemochromatosis. Liver disease, alcoholic cirrhosis. Primary liver cancer in hepatocellular carcinoma is the most commonly associated cause from chronic hepatitis, cirrhosis, hemochromatosis, alpha-1 antitrypsin deficiency, Wilson's disease can cause hepatocellular carcinoma, and it is the primary liver cancer. Congenital conjugated hyperbilirubinemia, black liver, the most common or important association with Dubin-Johnson syndrome, inability of the hepatocytes to secrete conjugated bilirubin into bile. So that's the most commonly associated syndrome, Dubin-Johnson syndrome, congenital conjugated hyperbilirubinemia, black liver. For hereditary harmless jaundice, associated or commonly common is the Gilbert syndrome, the benign congenital unconjugated hyperbilirubinemia. So this time it is benign congenital unconjugated hyperbilirubinemia, the Gilbert syndrome. For the conjugated is the Dubin-Johnson syndrome. Hemochromatosis, most commonly associated with multiple blood transfusion or hereditary HFE mutation. That is can result in heart failure, the HFE mutation, bronze diabetes, and increased risk of hepatocellular carcinoma. For pancreatitis, acute pancreatitis, commonly caused by gallstone or alcohol. Chronic pancreatitis is commonly caused by alcohol in adults and cystic fibrosis in kids. For microcytic anemia, commonly caused iron deficiency is the common cause. Autosplenectomy, fibrosis and shrinkage associated commonly with sickle cell disease, hemoglobin S. For bleeding disorder with GP1B deficiency, commonly associated with Bernard-Solier syndrome. This is a defect in platelet adhesion to von Willebrand factor. Hereditary bleeding disorder associated commonly with von Willebrand's disease. The DIC is commonly seen in severe sepsis, obstetric complications, cancer, burns, trauma, major surgery, acute pancreatitis, and APL. Malignancy associated with non-infectious fever is Hodgkin'S lymphoma, the most common cause for malignancy associated with non-infectious fever. Type of Hodgkin's lymphoma, common is nodular sclerosis versus mixed cellularity, lymphocytic predominance, lymphocytic depletion. That is for nodular sclerosis. T1418 is common in follicular lymphomas that has BCL2 activation, anti-apoptotic oncogene. T814 for Burkitt lymphoma, C-MYC fusion, transcription factor oncogene. Type of non-Hodgkin's lymphoma, commonly associated with diffuse large B-cell lymphoma. For primary bone tumor in adults, the primary cause is multiple myeloma. All ranges for patient with acute lymphocytic leukemia, CLL, AML, and CML. So for ALL, child. For CLL, adult greater than 60-year-old. For acute myeloid leukemia, that is adult around 65-year-old. Then the CML, around adult 45 to 85-year-old. Let's proceed to part 3.